Hi everyone, it's Lisa Robbins. Today we are going to be reviewing the PI DDR report from Trauma HQ and specifically looking at how we can use the clinical management guideline information that is entered into Trauma HQ through the report to generate some monthly compliance metrics. So after you run the PI data download report from HQ and you export it to Excel, you're going to see something that looks a little bit like this. The first most important thing is to delete these first couple of rows because you want your headers to be in row 1 when you're working in Excel and when you're using a pivot table. This is the data download PI report exactly as yours will appear with all of the fields. This is for our St. Luke's Monroe campus, which is one of our network's level 4 trauma centers. The only thing that's been edited in this report, so the columns won't line up exactly with your report, is that any patient identifying information has been removed from this spreadsheet. So this is a dump of all of the PIPS records that are generated in HQ, just the PIPS records, none of the registry information. Registry things are specifically located in here, but the cool thing in our PIPS record is that we have the PIPS information and then it leads you into the registry information as well. So I really personally like this report a lot because it's got all of the PI and all of the registry data kind of combined in one. So it makes it a little bit easier to work with when you're trying to drill down on certain patient populations and look for details about cases. So orient yourself to the different sheets on the bottom of this spreadsheet. There's one for our tracked event repeat groups, operative procedures, scene provider transport. There's also meetings and referrals that can all be used in different capacities. I like to use the referrals repeat group to see if we're missing any replies for emails. So you can see any emails are uploaded into the system, who they went to, and then you can see if a reply is missing. So we have 5 emails here that we can see did not have an email response. So that might be something that we need to follow up on, or maybe we got the reply and we just forgot to upload it into HQ. For today, we're really going to be working back on this main data sheet. And the first thing that we need to do is clear the carets from this spreadsheet. So the caret is that little green triangle in the top left corner, and it's basically telling us that there's an error. We get this caution sign because it doesn't know that this is supposed to be a number, and that can cause some problems when we're trying to pivot our data. So the easiest way to clear your carets is to click in any cell that has a caret, and then you're going to press Control A on your keyboard. And then you're going to convert these to number, and it's going to go through the entire sheet and it's going to convert them all into numbers. After that's done, now we're ready to really kind of get started. So you can see, again, these are all Monroe campus cases. Most of them are incomplete. We only complete records that are deaths. That's our process. And we can see that primary review, whether it was completed or not for these cases where no issues were identified. And then we are putting our full primary review under the primary review comments section in HQ, and then this would show us all of the notes from that primary review. Tells us who our PI coordinator are, and then we move in to our clinical management guideline sections. This is where we're really going to focus for today for pivoting. However, in order to have accurate pivot tables, we need to separate out the date from the time so that we can group our compliance by month. We could also group it by quarter if as long as we're able to group it by month. And right now in this Excel spreadsheet, it's combined as date and time together. So the first thing you have to do is scroll all the way over, and I'm sorry if I'm making you a little bit dizzy, but we have to keep scrolling past the PI section, past the audit filters, until we get to the registry information. So here you can see that this is kind of where our registry information starts, our institution number, PTOS, etc. And here's our column that says the date and time that the patient arrived to the hospital. So this is where we want to start in order to pivot just pull out our date so that we can pivot it. We're going to right click and we're going to insert a new column, and we're going to call that the arrival date. We're going to use a formula that pulls out the date from the time, and that formula is equals INT, open parentheses, click on this cell because you want that date pulled out, close the parentheses, and hit enter. This is going to automatically generate as a number because it doesn't know that you want it to be a date. So you have to go up here to where it says number, and you're going to tell it that you want it to be a short date. And this is going to make it 9/9, which is exactly when this patient came in, 9/9. The easiest way to pull this formula down is to go in the bottom right corner. You're going to get this little cross here, and you're going to slide it down. So we're going to slide this all the way down to the bottom of our subset of patients. And now we have the arrival date. So now we are ready to pivot. We know what's in our data set of information, and we know when the date is that the patient's arrived. So I'm going to scroll us all the way back to the beginning. I need to highlight my entire sheet for my pivot table, which I'm going to do by clicking in between A and 1. Insert pivot table. We do want it on a new worksheet, so we're going to click OK. And then this is going to be our pivot sheet. I like to label this pivot just in case I switch to a different sheet and then I'm not sure where I am going back. So over here we have our pivot table fields. We're going to be working with filters, columns, rows, and values. And here we have every single header for every single column in the main data sheet of this Excel. So when you start scrolling down, initially it's going to give you your PI fields. But then if you keep going all the way down, you're going to see all of your registry fields as well. So this combined report is really valuable because not only can you look at the registry information, but then you can quick snapshot look at some of your PI information along with it. So for the first look that we're going to do at our CMG compliance, we want to pull the date down. So I'm looking for that arrival date that I created, and I'm going to pull that to rows because I want September, October, November, and December in each of these rows. We're going to do every patient that's in the list. We could filter out PTOS if we wanted to. We could do just TQIP records if we wanted to for higher level centers. We can filter any subset of patients that we're looking for. But for today's purposes, we want to look at all of our patients. So when I scroll down this list, I see my first CMG or policy that can be assessed for compliance. I recommend before you really start looking at your compliance, make sure that you're able to define your compliance, right? What makes this case compliant or not? What criteria need to be met? What check boxes need to be fulfilled in order to be compliant with this case? And same, what makes it truly non-compliant for this case? And I think that having that kind of a document, that's what we use, laid out to say off of our CMG, if X, Y, and Z are not done, then this case is non-compliant. And if X, Y, and Z are done, great, it's compliant. So our first one here is abuse screening and management. And you can see as this goes down, you have each of the CMGs or policies, and then you have, was there an identified deviation? And so here you have adult resuscitation management, and then you can see adult resuscitation deviation. So some of them look a little bit different, but you will find that that you can kind of find the flow of these. Some of them are the attachment. If you were looking for that in specific, it might be helpful to pull this over a little bit so that you can really see what's written in all of these fields. So first, we want to filter abuse screening and management to just include the patients that were screened for abuse, meaning they were screened for this CMG, not that they were screened for abuse, meaning that we assessed if this policy was followed for this patient. So in HQ, our options are true or blank. So we only want to include the true cases because the cases that are blank, we didn't assess if we followed our policy or not. I hope that makes sense. I know it sounds a little bit confusing. I think after we do a couple more, it will make a little bit more sense. So we only want the true patients. Now we have no patients in this list, so we need something in our values. Typically, I use the patient's last name under values, but since we do not have any identifying information, we're going to use form status because I know that every patient has a form status listed. So here you can see how many patients each month were screened for this policy. Not were compliant, but were evaluated to see if they were compliant. Then we have to use this field, was there an identified deviation? And we're going to pull that to columns. When we pull that to columns, it gives us our answer of how many patients were compliant and how many were non-compliant. Now you have to remember when you're looking at this that it's asking if there was a deviation. So you want there to not be a deviation. So no is good. So 17 cases in September, there was no deviation with our abuse screening policy, meaning that 17 out of 18 patients were compliant with this policy. If I want this percentage, I right click and I hit show values as percent of row total. And that's going to show me that in September, we were 94% compliant, October 91, November 100, and December 100% compliant for this metric. This is a great way to trend your overall compliance for some of these policies. So let's do a couple more. I'm going to put this, was there an identified deviation back? I'm going to unfilter this abuse screening management case, and I'm going to put that back as well. The next one we're going to look at is anticoagulant reversal. So we initially need to filter any patient that might have needed anticoagulant reversal. So by clicking only the trues, this is going to pull the patients that the PI team screened for anticoagulant reversal. So if I want to know what my raw number is, I can right click here. I can go back to no calculation, and I can see that I have a very low volume of this of patients that meet this clinical management guideline 3533, but a very serious subset of patients. So I would want to then look and see, was there a deviation? I'm going to pull that to our columns. And you can see no, none of these patients had a deviation. So again, it's really important to make sure that you're defining what does this clinical management guideline mean. If I am asked what is compliant for these patients, it means that they were reversed with the appropriate agent in an appropriate amount of time. And we have that all laid out in our clinical management guideline. The next one that we're going to look at, we have to throw that back, unfilter anticoagulant reversal. Let's go down to long bone fractures. We can see how many patients were screened, low volume as well. And were there any deviations? No, no deviations for this clinical management guideline either. I want to find one that has some deviations. Let's see. Open fractures. Okay, great. So very low volume of open fractures. You can see each month we only had one or two. And in October, we were only 50% compliant because it was only two patients and one patient was over the 60-minute mark for antibiotics for whatever reason that may be. Don't forget that when you're looking at CMG compliance and you want to know who is this patient that was non-compliant, when you're working in a pivot table, you can double click and it will pull you to the case so that you can then look it up in HQ or and really and dig in to see what happened with this patient. Now, mine, since I deleted the patient identifying information, I don't have the trauma number or the medical record number, but yours would have that as well. But also, I have the summary, so I can see what happened to this patient and kind of know what the deal was of what happened. We're going to go back to our pivot table. We're going to put open fracture management away. And we're going to go to trauma activation criteria. So a large volume of our patients, I'll change it back to count so that you can see, are reviewed against our trauma activation criteria to make sure that they are appropriately triaged. So 18, 23, 9. And then this is going to help us to look at, were patients under triaged? If a patient was under triaged according to our trauma activation criteria, we would mark that there was a deviation. So we're going to pull this deviations over to columns. And you can see that in September, October, and November, we did each have one patient that was under triaged each of those months. So if I change this to row total, it's going to give me my compliance with our trauma activation criteria. And then if I want to make this into a graph to share with my team, I'm going to copy this information, open up a new sheet. I'm going to merge and put the year here so they know that it's 2024. Trauma activation accuracy. I can highlight this and insert a graph. Now I'm going to edit this a little bit because you can't be over 100 for your compliance. There's no extra credit. And I don't want extra decimal places because I think that they don't look nice. And I'm going to change it to be on a scale from 0 to 100. Now, this is something that I can share with the team, trend over a period of time, and show that we are having improvement or we're having consistency with our activations in our emergency department. If we go back to the pivot, we're going to put back our deviation and our trauma activation criteria. We're going to unfilter. And then this is also a great place where we can see, was an MTP initiated? I'm going to change this back to being no calculation so I can just see yes or no. So you can see that in October, we did have one patient that was an MTP. If I wanted to drill into that specific patient or look at specific information, I double click on it and it will bring me right to the case so I can look at details of the case. We look at the volumes of blood products for patients. And then we do have our audit filters here as well. Our audit filters are going to help show us the frequency each month of how often they are occurring. So we can see for missing EMS trip sheet in September, we had one, but we don't have a problem with missing EMS trip sheets. Most of these cases, we were able to get that. patients with a delay in XLAP, you could see that we do not have any, which would make sense. This is a level 4 trauma center's data. We should not be doing XLAPs on patients. We can look at patients transferred out after 3 hours of arrival. So here you can see our patients that were greater than 3-hour transfer outs and patients that were not greater than 3-hour transfer outs. So this would help us to show the frequency of the audit filter. Now, if I wanted to trend this, I can copy. I'm going to go over this sheet where I'm doing my data. I'm going to label this graphs, or I'm going to forget where it is again. Go back to my pivot. And I'm going to label this greater than 3-hour transfer out frequency. Now we do a lot of other work on our greater than 3-hour transfers. We track and trend the time, the percentage of patients that get out early, get out in enough time, the time to administratively discharged, which we can always dig into in another video. But just being able to track and trend the frequency of the audit filter can be really helpful. And back to our pivot, you can see patients with an open fracture, initial treatment greater than 24 hours. We don't have any here, but again, you can go down the list of any of these audit filters, nifty, and see who should have been highest level of activation and find patients that are flagging for that specific audit filter. I hope that this was helpful. I don't want to make this video any longer. I like to keep them a little bit short so that they're more concise if you have to go back to anything. But we've got a whole bunch of audit filters here. Not all of them are available yet through HQ. And I know that some of them need to still be tweaked a little bit for accuracy. But in the meantime, it's a great way to trend the overall frequency and to really kind of drill into your audit filters. If anybody has any questions, please feel free to reach out. Thank you.